All right. What's up, Joe 200? So it is Sunday, June 8th, 2025. We're going to be doing week 3. Um, as you can see, we're back home. Okay. So we're done with Costa Rica. Let's move this over here a little bit. And yeah, we got back at midnight last night. So we're dragging. After 2 weeks of hanging with students, with the good and the bad. So it was all good for the most part. Yeah, so we have in this, even though we only have 2 assignments this week, two content areas or modules this week, everything comes together. We talked about some of the diseases of aging that really require a lot of caregiving, and then we're going to talk about one that is really a difficult one to deal with. And sadly, the numbers are just mounting because we live longer. And those are the dementias and what a drain it is in terms of caregiving. And so that's going to be module 7. And then module 8 is, we'll look a little closer at this concept of caregiving. Excuse me. And we have 2 modules, but as you can see, when you come down here, you do have other things that are happening. Okay. This week, okay, these are, what's due June 2nd. See, this is kind of a big deal. And then we'll see that if we scroll over to our activities, God, I am going to cough and I'm going to have to get myself, not our activities, I'm going to go to the content area. We can go to activities, okay? Start there, okay? And we're going to assignments, okay? We'll see that coming up is your first writing assignment. All right, so June 9th. All right, so today is June 8th. So that'll be June 9th coming right up. Okay, so that's tomorrow by 11:59 p.m. So you only have 2 modules, but you do have this writing assignment that you could have started the very first day of class. It's, if you want to get familiar with how to do it, you can, click right here. Okay. And it's the full description of what this assignment's all about, okay? And very clear instructions. You're going to gather data from the world, our world and data. You're going to get data from the U.S. in 2 different countries, okay? One is going to be like the U.S., fully developed. A country like France, Germany, Japan, and the other one's going to be what's considered a developing country. Remember that group that we talked about, that is a group of 37 developed countries that do the analysis, and they define who is a developing country. All right, and this is the latest list down here, way down there. There they are, right there. So you'll go and gather data. Again, here's a slide deck on how to do it, and this is my my YouTube from fall 2024. It hasn't changed, and so I'm not going to create a new instruction how-to video. All right, it explains everything you need to do, and then you come down here. Here's your rubric. So you just, the easiest thing to do is you assembling this. Make sure that you check the boxes. Check, 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 and then you get all 10 points on this, okay? And then here's your frequently asked questions. And then these are the kind of graphs that you assemble. And so I put in some, little text box on, what you're going to do. So here's life expectancy right here, looking at 3 countries. So I did Afghanistan, United States, and Ireland, okay? So 2 developed, 1 developing. That's just the approach you can do. 1 is the United States. So it's 1, and then 1 developed, 1 developing. Okay. And then we're looking at, again, this concept of working age to elderly. So this gets to the financial burden and the caregiving. And again, you can see the current status, and then the recalibration, looking at the projections of what kind of changes we'll be seeing through here. Okay. And so, yeah, you check this out. Okay. Walk us through it, and then you'll be good. All right. That's that. Okay. So what I'm going to do then is I'm going to go back. So you can access this assignment not only through the activities page like I just did, but you can access it as well by coming through right here. All right. So if I go like that, And again, it's the same drill. So we just create a little redundancy here so that you can figure it out. Same drill here, right? So you work through this, you discuss it, and 2 pages of text and then a page of figures or 2 pages of figures, and you just do screenshots and you put those figures in, right? And the slide deck says it all. Alrighty, good luck, guys. Okay, so we're going to go down here. So, like I said, we looked at cancer and diabetes. We talked about the caregiving, and way back when we were doing the kind of the world summary, the kind of burden that is seen that the globally countries are dealing with, and then also we could look at our country, a focus on our country, and that's what we kind of did through 1, 2, and 3. All right, so, and then we explained why aging was a risk. We went deep dive into the key diseases of aging, and then we're going to talk about this, mental health, with a focus on dementia and Alzheimer's being just one type, okay? And then my next video will be all about caregiving, and I'll be discussing caregiving in this because you can't not to do that, okay? Another great graphic, okay, looking at somebody that's suffering from dementia and really just how their basic thought patterns, their memories are really just scrambled, okay? Awesome, okay. We will expect you to kind of read this information so you have an informed background, and then you can go in here and deal with the discussion for this week, okay, for this particular module. You can see that we raised some facts right here, okay. We discuss again the effect dementia has on caregivers because it's the financial burden on caregivers for you as an individual, and then we can look at it, as kind of the entire impact on the productivity in our country is just absolutely enormous, okay? And so then this is a really good video that talks about caregiving and shows some extreme cases, which is really, really tough, okay? And then this shows an example of Alzheimer's disease, okay? And in this case, they show a couple of people with parents with Alzheimer's. They show the caregivers. In this particular case, the caregiver is a memory care unit, it's assisted living facility. It's just won an award, 2014, at the Sundance Film Festival. It's kind of incredible because it's a whole new approach in medicine, and now every medical school, every not medical school, but care center, hospitals have these music as therapy programs because it's been shown that music really helps to reactivate the brain, okay, and this gives you at least this small window of improved clarity for patients, okay, and maybe even take a few pages out of the book, set it backwards in time, get a little bit of recovery, okay? So it's a big deal, especially if you guys have an interest in music. This is actually, let's say you don't make it in the music industry. This is another whole different career opportunity, all right? So then in the end, okay, so you see the crisis, we're talking billions of dollars, and really, the lost productivity, is insane, so 26 billion annually, okay, just from caregiving, okay, and then this goes into the total cost of the nation, many different ways, and this is how it climbs to this level, okay. In the end, your discussion prompt is we got to figure out a way to reduce the individual burden for you. Okay, so from someday, sadly, for your parents or grandparents, your aunties or uncles, you're going to need to help them. Either that, you're just as a society, if we're not compassionate, it's just a really scary concept of just letting elders with disabilities figure it out on their own, okay? Significant disabilities. And so one way to do this is to create again, a lot of you guys are finance people, a lot of you guys are Marshall students, and so you have a more business mind. So how can we create some financial incentives? Just like we can put away money for college fund, I can put away money for my retirement, okay? Why can't we have special, tax exempt or, special tax where there's less taxation and you can allocate it for caregiving of older family members. All right. Anyway, so that's what we want to do. And if you ever have some issues, yourself with caregiving, you live in LA, the gerontology has an amazing caregiver support center. So this is where Donna Benton runs our program. Lots of state funding for this, and basically she has 8 to 10 case managers where they will find you. They're like kind of like a spokes. They're the central hub of the wheel, and the spokes coming out. They'll connect you with all the different services to help you in terms of your caregiving journey. So it's because you go into it and you're lost. You really don't know what to do. And this is an amazing program that's put together for LA City. I think a little bit of LA County as well, but you can't hold me on that. All right. Okay. So that's it. Okay, so we're going to go into the content area right now. And so we like to give kind of a quick overview of all the mental health issues, okay? And again, you can always open up your quiz ahead of time and kind of rifle through this, okay? And so we don't have the URL here from the American Psychological Association because, oftentimes, people, programs and companies change their web content, and so this was such a quick overview, and it was so appropriate in the understanding. We did make a PDF file from before, and so you can just only access it by going into this area right here. If you want more information, you can go into the APA and look elsewhere. Okay. All right. So where are we? I'm so sorry. There it is. It's really hard to see the pull down bar in Brightspace. All right. So let's look at this. We're going to look at the growing mental health and behavioral concerns facing older Americans. And as a result, you as an individual, you within American society. Okay. So they just go one by one and they kind of go through everything that's going on. And the fact that we have a mental health care crisis in our country, and even more so in terms of older populations, okay? Because oftentimes people will, they fall away from their prior friends, their family, and they're just kind of lofting in the wind by themselves. And we need psychologists to help them. We need psychologists and therapists and psychiatrists for all ages. It is a really, really sore spot in our healthcare system. A lot of people won't become therapists or won't go to medical school because for the amount of work that they have put into their practice, the reimbursement from insurance programs is oftentimes really, really poor, and no different with respect to Medicare. All right. And then, and you also need somebody that's a psychologist that will specialize in dealing with older adults. Okay. And when we look at mental health and we look at something like clinical depression, it's a very organic disease, meaning it's biological. And we see that the first age of onset is really your age group, okay? But, and it has a lot to do with how the chemistry and the circuitry of your brain undergoes such crazy development during your particular phase, okay? From about 16 to about 30, there's so much change going on that it puts you at risk for having clinical depression. And also there's a lot of things that happen at your age where you're out on your own for the first time. It's scary, you're having to fit in weird places, socially for the first time, and it's scary, on and on. And then what happens when people get older is their social circles tend to decrease and they become really lonely. Okay. So there's big problems that are age specific. You grow old, first of all, I've had, lots of issues the last couple of years because of my chronic injuries of aging, keeping me from being the athlete I want to be. So that really gets in your head, okay? You can have somebody who's been your spouse your whole life and they die. So this is me, the loss of mobility. I'm not to the point of not being independent, but wow, what a change it's been for me, okay? So, when you get to the point that you have to go into some long-term care facility, for most people, they go, they say their whole life, never me, never me. And this, admitting, once you get admitted, then there tends to be this tendency when you're in an assisted living facility or you're in especially in a nursing home, rapid physical and mental health decline. All right. So these are all big issues, that are part of, aging and mental health. Okay. So older Americans, okay, these are just, the concept of how many people suffer from mental, health disorders, so, 20% of people over the age of 55, which is really not that old. And then when you go and you look into, let's say, a nursing home, you see that, 66%, 2/3 of the people have severe mental health problems. And the other thing that happens is, there's a stigma. And so people highly and underutilize what's available. Okay. And the other thing, like I said, there's a lack of service, lack of collaboration between healthcare. Here's that stigma that I was talking about. Okay. And there's not a lot of specialization in geriatric mental health problems. Most people are going to look at developmental changes in terms of mental health. Okay. When you have mental health, and you're experiencing fear, distress, anger, and you lose your social support, these all affect your other aspects of your health. So you get sick all the time. You have just this really significant decrease in immune function. You're more likely to have vascular problems like we talked about, diabetes, okay, and all kinds of other problems associated with health, right? All right, so we see depression and suicide are a big deal. Okay, we'll see that the onset of depression peaks at your age, but while some people are able to manage it, some people never do. And so we look at each age group at a graphic later on. You see, there's still quite a few people that are depressed in old age. Okay, it may not be their first occurrence, which would be the onset, but there's their whole life they've been dealing with it. And sadly, because of the loneliness and the loss of spouse and everything I was talking about, and there's this depression where you feel hopeless. So the suicide rate goes up dramatically as a function of age. So that's a big deal. Big deal. If you go into the profession to be very, very aware of. Okay. Alzheimer's disease is just one form of mental health. There's many, many different ways that dementia can express itself. There's a lot of overlap, okay, in terms of how one form can cause another, et cetera. We'll see that later on. It goes through the stats right here. And the other thing that happens is with all the loneliness and the changes, like I said, where you're starting to lose your mobility and you're starting to lose your identity. There's a significant amount of substance abuse, especially alcohol, as people get older. And that's really a bummer because you could guess that liver and kidney function do not work as well to clear the alcohol. So it's pretty high risk. Okay. We have a new wave of problems here in our country associated with the legalization of the recreational use of marijuana, and the marijuana being so much stronger now. So there's all kinds of problems associated with that because many of the baby boomers were part of the 60s and 70s, hippie generation, etc. Okay. Like I said, there's so much, this is me. I'm part of this arthritis problem, not hypertension yet. Okay. Not heart disease, but you see all these diseases. Okay. I'm starting to have hearing loss, starting to get my cataracts. Okay. All these chronic illnesses can contribute to the likelihood of having mental health. We need more people to specialize in the more aging aspects of becoming a psychologist. And this is the call, okay? Call to action. anyways, very, very cool. I want you guys to, it's a short read, as you can see. So just please check that out. Awesome. All righty. What do we have next? Okay. So this goes back to what I was talking about. So this is when you first get diagnosed with clinical depression. Again, your age group is super high right now, like because of it's both a nurture and a nature thing. Nature is the changes in your brain chemistry and the changes in your brain connectivity that happen just because this is the way life is in terms of development. Okay. And it puts you at risk for having clinical depression. Women outnumber men between 2 to 1 and 3 to 1 in terms of clinical depression. And it has a lot to do with a genetic predisposition that relates to estrogen and their X chromosomes. Okay, we're XY and women are XX. That's a whole field unto itself. Again, we're looking at the first age of onset right here. And you see, just because, you see this decline, these people don't disappear, what I'm trying to get at. All right, so they may get things under control, okay, and we come out here and see, oh, that's very few people. This is the first time people saying this is the first time I've been depressed, okay? However, when we add up these people that have had continued depression with their lives, we get to the second graph right here. And so we're looking at the share of adults that express anxiety or depressive disorder, okay? And so we see, in our country, in this one, Kaiser Family Foundation is a really great nonprofit that has a lot of people, and they go out and they do kind of like Center for Disease Control analysis of populations. Okay, great job for when you get if that's what you're interested in. And so across our country, at any one point in time, a third of people have clinical depression or severe anxiety. Okay, like I said, okay, this really comes in hard for you guys, 18 to 24. All right. So here it's showing that, 40%. Okay. This is again, first time of onset, but this is when we look just across the board. Are you having severe anxiety or are you clinically depressed? Okay. And, this is where it's really, really altering your ability to function. And you see, it's a big number. Okay. And it goes down, with age. But you see that there's still a significant number that remain depressed here in these age groups compared to the age of onset. So that's just to let you know. So you see that while, this age group has a lot more depression per, percent of the population than here, you see this is in percentiles. The problem is when people get older, they have a higher risk of suicide right here. We see this across the board here. Boom, 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 boom. Again, there's a big risk for suicide here, developmentally. Okay. You're away from home, you're leaving college, you got to make it, etc. Social problems. Okay. Boom, boom, boom. But you see also why does it creep back in is for the very, very clear aspects I was talking. I am sorry. Okay. It's for the, features of aging I was talking about where, you lose your circle, you lose your, identity in terms of being an athlete or whatever, your independence, things like that. Okay. All right. Very cool. We see that, again, this is this is the suicide rates. Okay. And then we can hone it down based on different groups. Okay, so we can see here, so this is right here, American Indian and Alaskan Native. And this is really troubling, how we have turned our backs on this, this subset of our society, this culture. And they've done really, really poorly. Again, women are more likely to be diagnosed with depression, but men, because of testosterone, are much more likely to commit suicide. Okay. And sadly, with our Second Amendment, they're much more likely to do it with a gun. Okay. And, we see, white non-Hispanics are, right behind them, and it goes boom, 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 in terms of all the different groups we're looking at here. All right. So that's just pretty troubling, sadly. Okay. When we look at, mental health, this takes us back to the previous week. Remember I mentioned with diabetes, and now we're changing gears and we're looking at dementia. And we see here that 80% of people with Alzheimer's disease are either almost have full-blown diabetes, which is called insulin resistant, or they are a full-blown type 2 diabetic. So that is troubling because that's the environmental side. And why is that happening? Okay, because remember, it messes with your blood vessels. Remember, it candy coats it, and you get atherosclerosis. So when that happens up to the brain, you don't get good blood flow. All right, so you have kind of problems with oxygen not getting into the brain. That causes cells to die off. And then the second part is that you get inflammation from diabetes in those blood vessels, and then the immune system incorrectly enters the brain and begins to attack the nerve cells, and then that causes nerve cell death as well. So this is why controlling inflammation is a big deal, as well as controlling diabetes, so you get better blood flow. So there's very large clinical trials looking at controlling inflammation and seeing if that could slow Alzheimer's disease. And the other one that is in process right now is we have the golden weight loss drug, the semaglutide, the GLP-1 agonist, the Ozempic, Visbelius, or whatever you want to call it. It's been approved for diabetes and weight loss. Now it's being tested to see if it'll slow down the progression of Alzheimer's. Right. Very cool. So what we have here, you see this right here. These are where we've made PDF files, and then this right here takes you into the NIH website. So you can read through that and ask, address, what are the causes of Alzheimer's disease? And they get into this concept of age being the greatest risk factor. Okay. And of course we know that's going to happen. You have accumulated damage, accumulated vascular problems. There are genetic risks. Okay. One where you can inherit a gene, it's less than 5% of the cases, then you have a pretty much guarantee that you're going to have dementia. And then there's another where there's just you have a risk factor associated with getting vascular disease. So it's the same risk for getting increased cardiovascular disease if you don't exercise, if you don't eat right, and the same gene kicks in about 40% of the cases. It increases the risk of Alzheimer's. It's called the ApoE gene, and this is one that you've heard of, the bad cholesterol. It's part of the whole bad cholesterol concept. So anyways, just leave it at that. Alrighty, so that's that part. And so, again, here's a PDF file. And then, here's, risk factors. So it gets into who's how's it happening? Well, what are the biological processes, on and on. So you can check. There's a video here that you watch, and we list that later on. All right. And then this is, what the signs of Alzheimer's disease, and it's important to know. Okay. And we'll go over the fact that a lot of people they have normal age-related changes in their brain, and people are like, oh my God, I'm demented, or oh my God, my parent or grandparent is demented, and not necessarily the case. Okay. So we keep talking about Alzheimer's. Okay. These are other types of brain diseases that can cause dementia. You can have little tiny strokes, right? And they accumulate over time. Okay, this is kind of a gray area in terms of which is which, but this can be very clearly diagnosed with the right type of imaging done in your brain. So low E-body is very similar to Parkinson's. In fact, Parkinson's and Huntington's disease cause dementia later on. Okay, so this is the same kind of pathology as Parkinson's, but it's happening in the cortex instead of the movement part of the brain. This is frontotemporal. All right, so this happens. The progression of disease with Alzheimer's, traditional Alzheimer's, it's just working memory. You lose. You don't remember people's names and faces. You don't remember how to go places, or you go outside, you don't remember how to get back home. This is what this part of the brain, the hippocampus, and then it progresses up to the top of the brain, they control. Okay, frontotemporal, this is one that Bruce Willis has made kind of famous. It starts a little differently. It starts with expressing language, okay? It doesn't, so you can't get out the words as much as to what you want to say. And then also the frontal cortex is our decision maker. It's our emotional brain. It kind of controls our emotions. And so, as you might guess, people with frontotemporal, they have really poor decision making, and they're emotionally, they kind of regress. They become very childlike. Okay. All right. So yes, so that's, and you can have a mixture of all the above. So those are all the categories there. And then as we scroll down here, okay, this right here explains the pathology, and you can check this out. So again, so we have Alzheimer's, frontotemporal dementia, Lewy body, and this is what a Lewy body looks like. And it's a one type of protein that accumulates, okay? In Alzheimer's, it's been known for these two types of proteins, okay, that cause degeneration of the nerve cell. These are called amyloid plaques and tangles. The newest medication that has been developed doesn't really work, super expensive. It's an antibody infused into a person's veins, and the antibody binds to amyloid. And it's thought to kind of like suck it out of the brain, but it really doesn't work very well. It's terrible. This is the vascular dementia. We have little tiny strokes, like I told you about. Okay, frontotemporal. This one's a little bit different. This one's tau. Okay, happening here and here. All right. So, anyways, just sadly, all we can do is we can try and give it a name, and then we. How do you diagnose it? It's through a neurologist doing an analysis of symptoms. So remember, here's wandering, getting lost. That describes this type, okay? And then we see here decision-making, impulsive emotions. There can be Parkinson's-like. Like I said, this is very similar to Parkinson's, okay? Like I said, it was language, okay? So that's frontotemporal. Excuse me while I try not to sneeze, okay? Alrighty, cool. So this tells you when it's typically diagnosed, how you do the diagnosis. Like I said, it is it's kind of difficult to make a super accurate diagnosis, but it's usually done by what's called a physical exam, a neurological exam. There are not really good lab tests you can do imaging. They're super expensive, okay? Sadly, there's no cure. Okay, there are treatments that are thought to slow the disease. They don't work very well at all. Okay, and and that's where we're at. There's a what are called acetylcholinesterase inhibitors that act like Cinnamate does in Parkinson's, okay, but it really doesn't work very well. Memantine or Namenda is another one that's supposed to get rid of the overexcitement and toxicity, and like I said, that doesn't work very well. And then the other one, like I talked about, was the antibody. Okay, alrighty. So some people worry, oh my God, my parents have dementia. Am I going to get it? So that's what I was telling you about before. You can learn more about the genes by going to this particular website right here. Most cases, no. Okay, so anywhere from maybe even, like I said, 5, but really 3% is inherited. So that's a small number. Okay, in terms of passing down those genes, there is a risk disease. Okay, and that interacts with lifestyle factors. So even if you could get the test done for that risk disease. And just know that you need to change things like smoking and diet and things like that. All right. Okay. Awesome. This is the video from what I showed you above. What we see here is that men and women cruise at about the same rate, but then you see that this is the number per 100. Oftentimes it's per 100,000. It's per 100 people of this age group that are men and women. And we see darker green. I should use different graphics. Women, you see begin to weigh outnumber men. So women live longer, and those that do live longer, they might have a much higher percentage of becoming demented. It has a lot to do with the long-term effects of menopause and losing estrogen. Like I said, that's kind of a difference in risk. Okay. All right. So this goes over the caregiving issue again, okay, that I showed you before. In the discussion, and so we see that this was in 2024. It only goes up, and it just goes over, the facts. 7 million people are living with Alzheimer's in our country. 7 million. Okay. 1 in 3 older adults are going to die with Alzheimer's or some form of dementia. It kills, when we look at that age group, more than twice the amount that we see for the combined effect of both breast and prostate, the two most common cancers in men. and women. Okay, and this is looking at all the lifetime risk. I have my friend. He really missed me. Hi, buddy. Hey, what are you doing? Come here, my star. Daddy, sit. He's a good boy. Did you miss me? I missed you, Dad. All right. Yeah, we were gone for 2 weeks. 2 weeks. All right. So we see that again, the lifetime risk of women. Why does that go up? Okay, has to do with the lack of estrogen and what that does. Okay, that's at least where people are looking at right now. Okay. We see the cost. Okay, there's that 360 billion cost to the nation. Okay, by 2050, we're going to see it by 1 trillion. And this is a combination. These costs are looking at the direct cost of care, the direct cost of somebody who's a caregiver who can't work. So these are, we're starting to look at like 60 million. But then when you don't work, okay, because you're taking time off, then economists can look at what's that doing to that particular business that relies on you as a worker and you're not around. Okay. So it has a huge cost. Okay. We're looking at that caregiver right here. That's the person like you're caring for your grandma or grandpa. There's a huge amount of stress that is on you because you're having to balance your life, your kids, this patient that is your grandparent or parent who is not easy to manage. And so it's really hard on people that do caregiving. And when we look, again, 8 million people in our country are doing this type of caregiving. And this is just, you're not paid for this. Okay. You're just taking time off from work. Okay. And this is the amount of hours, working. This is again, they calculate the hours and that's the value, which is, like crazy. They're thinking these billions. Okay. And, very stressed out. Okay. And, so they need a lot of help. And that's what the RUSC caregiver group's all about. Okay. This is more numbers right here. Okay. This is like, do I have dementia or am I just, normal age? So yes, I get age-related changes, bad decision once in a while, but this is constant. Okay. Sometimes I forget to pay a bill. This is constant. Okay. Do I forget what day it is? And then remember it later? That can happen. No idea, dates, seasons. Okay. Sometimes I forget words. Their language really declines. Okay. On and on and on. Okay, so you can see this. Again, a trained psychologist will do what's called a mini mental status exam. And they work with a psychiatrist and a neurologist to make the firm diagnosis that this person has dementia. And they can categorize it at the different times based on the behavioral decline that's happening. It's like a puzzle that they're trying to figure out. And like I said, sadly, there's not really anything that's going to stop it. Okay. So it's a bummer. It really is. Okay. So, what can you do? So these are the 10 signs. It's a really good, website, American Alzheimer's Association. And they go over the 10 sites, 10, let me get out of here. 10 signs that somebody has dementia. So you guys can go check that information out. Okay. And, it's very, very useful. Okay. And all right, so that's it. So you guys got the feel on this, hopefully. Okay. It's not, this is not a pleasant thing to have to deal with, but knowledge is power. And the more you know, the more you prepare for this, the better equipped you are for dealing with it. Okay. All right, guys. Peace. And we'll see you next lecture with our caregiving lecture.